How are you?
This is the first time I've called for this show, and I'm going to try to keep this brief. This definitely does have to do with looks, but I think that it's something deeper. I've been noticing dark under-eye circles, and that was one reason I called, but I think that all of this is linked with, I mean, I am losing my hair, and I mean rapidly. It's embarrassing. It's right at the front. It's not, you know, and I mean, even I saw a picture, and I was absolutely horrified.
Lee, I'm gonna stop you right there, and I know Dr. Dempster's probably jonesing to answer this question. So you've got some what we call male pattern balding in the front of the hair, dark circles under the eyes, you know, rapid hair loss.
Right.
Is there anything else that's striking before I let Dr. Dempster answer? It sounds like hormones to me, but
well, see, that's what I was thinking. But you know, I've gone to my medical doctor, and it's almost like I have to go in there with guesses, like, well, could it be hormones? Could it be iron? It's like, why am I didn't go to med school, so why am I coming up with these possible?
Well, and this very thing is the idea of functional medicine. Creating a new you for 2011 is also all about going to your doctor with the right questions and looking a little bit beyond the idea of, do I have a disease? Is there something medically totally wrong with me? Or am I just sort of in that gray zone of sort of non-functional? So, Dr. Dempster, how could she possibly approach her doctor? What might be going on with her? What are some of the options?
There's a couple things that I'd look at immediately, and hormones are definitely at the forefront here. I would be making sure that your thyroid has been assessed thoroughly. And what will happen is sometimes we can skimp out on some of the blood tests. So you want to make sure that not only is your TSH getting checked, but your T3, T4, and your anti-TPO.
Can you slow down? I'm writing this down.
Sure. I'm sure we can give you an email that we can follow up with you.
Yeah, we'll follow up with you by email.
Okay, please, because I mean, I want to get these tests, but I don't know why I always have to come in there with, well, can we test for this or that?
Well, you know what? We're all responsible for our own health, aren't we? I mean, some of the message tonight will be, here's some recommendations, some options inside and out, but at the end of the day, we're all very responsible for our own health. So, you know what? Dr. Dempster has graciously offered to follow up with you in person, because these functional questions are quite often very meticulous in detail. So start with your thyroid, do a full workup with the hormones, and possibly even entertain the idea of a full once-over with a naturopathic doctor, such as
Get
Dr.
your cortisol
Dempster.
levels checked.
Cortisol as well.
For sure.
Cortisol, okay, good.
All right. I hope that helps.
It's a good start. At least I'll be a little bit more armed and not always giving the answers, but thank you.
Good luck.
You're
welcome.
All right, well, it's time for another break. Up next, how fat can help you lose weight and look beautiful. And we're giving away a deep cleansing facial with microdermabrasion, 2 laser hair removal sessions, hydrogel, and $500 towards service, courtesy of Dr. Matta's Cosmetic and Laser Clinic in Brampton. So call us, tweet us, or email us now with your questions. See you on the back end.
Reach us in the GTA by dialing 416-872-2724 or outside the area at 1-888-863-2724. Send an email to wildonhealth@cp24.com or follow Bryce on Twitter by visiting cp24.com. CP24, Toronto's breaking news.
Would you believe me if I told you that dietary fat can actually help you lose weight? Well, it's true. And joining me now are Dr. Matta. He's from Dr. Matta's Cosmetic and Laser Clinic, and Dr. Dempster from the Dempster Clinic. Guys, fat for weight loss. Let's start actually with you, Dr. Matta, because fat's also excellent for the overall skin. So, Dr. Out, maybe you'll explain omega-3 fatty acids.
A little bit of in. Yeah. We all have heard about cod liver oil being given 50, 60 years ago, and I think one of the worst things is that we've stopped doing that. And the essential fatty acids, the fish oils for the most part, we've always heard are brain food, and the main role that I have in my clinic is for cardiovascular risk. You know, regular use of fish oil will reduce your risk of sudden cardiac death by 50%. All the studies show that, so it's just absolutely crucial. If I had a pill that did the same thing, you know, people would be knocking down my door. But you tell them to eat your fish or take a fish oil supplement, they seem to resist that a little bit. You know, not to mention the beneficial role in psychological disorders, psychiatric disorders like depression, schizophrenia, bipolar, all of these conditions.
So it goes far beyond just skin and skin beauty, which of course it's amazing for. And in fact, on the the heels of that kind of information, 50% reduction in heart attacks, I mean, or heart disease. 50% of heart attacks are silent. A lot of us walking out there right now don't even know you have heart disease. So, and for weight loss, Dr. Dempster, weight loss. I mean, fat for weight loss, taking these omega-3s, you're going to lose weight?
We have to eat fat to lose fat, and omega-3s can be very helpful for some people to create an optimal fat-burning zone, but one of my favorites is a non-hydrogenated coconut oil. And this is what we call a medium-chain triglyceride, which will actually use fat molecules, and it will actually start to create a fat-burning cycle in your body.
Excellent. Yeah, it's really interesting how this all works. And it exists as these fat molecules at the level of every single cell, the trillions that, of course, were made up in our body. Skin, heart, you name it, brain, of course. Well, we've got some tweet questions already coming in. And, you know, Williams Jody asks, what is best treatment or filler for large pores? That would be a question for you.
I would generally move towards a laser treatment for large pores.
Okay.
Something like a Fraxel works very nicely. It's probably the most common thing I do, and it works absolutely beautifully.
Fraxel, we did some of that at your clinic as well. We have some footage of that.
We actually did some Maximus, which is a non-laser, but it's a radio frequency, which we can see.
So many different treatments there. It's confusing.
That's it. Well, here's the Maximus.
Okay.
And that can be used for stretch marks, for a little bit of fat breakdown, especially in the case of mummy tummy. You know, people who have had babies or have lost 20, 30 pounds, and they still got that little bit of tightness, that looseness of the skin. And it can also be used on the face for pores. And so it'll tighten up the skin.
That's excellent. And it's relatively, you know, it's not natural, it's a machine, but it's non-invasive. You're not, it's not pharmaceutical. No. There are no real risks or side effects for it.
Completely safe. It's basically just getting heat deep into the tissue to stimulate it to produce more collagen.
Let's do a quick call with Susan from Toronto. Welcome to the show, Susan.
Hi, good evening, Dr. Wylde. How are you?
I'm excellent, thanks. Go ahead with your question.
Okay, my question is, I have psoriasis, and I'm getting it on the scalp as well, and I don't know what to do for it.
Stubborn. Psoriasis is stubborn, definitely. Yes. I'm going to ask you, Dr. Dempster, I know it's a medical condition that's really stubborn. Dr. Matta, I'm sure you deal with some of it in your clinic as well, but the question from Susan was about psoriasis.
Okay.
She's got it on her scalp, she's got it on her body, if you didn't hear that.
Yeah, I couldn't hear it.
What would you do for psoriasis, quickly?
Once again, I'd be looking at what's going on with your digestive system, and specifically looking and ruling out any food sensitivities or food allergies. This is one of the first things. The other thing you're going to want to do is do what is called an essential fatty acid profile. And if there's ever an imbalance with these, this is where you can start to create an
We were just talking about that, right? I mean, taking really high dose of essential fats is normally what I do with my patients, but if they're not actually metabolizing them or using them effectively, taking a high dose actually might not help somebody with psoriasis, correct?
That's right.
Yeah, so ruling out food sensitivities, is there an application, a topical, something that you would recommend?
There's medical treatments, but I can't agree more with Dr. Dempster in terms of food sensitivity. And one of the most common that I've seen, I think you'd probably agree, is gluten sensitivity.
Absolutely. You've written papers about this. You've lectured about this.
Yes,
gluten,
and you know, it's been resisted in the mainstream medical community. They don't realize how important gluten sensitivity is. And I've had patients for 20 years, their asthma clears up, their eczema clears up. Every inflammatory condition in their body improves just by getting rid of the gluten.
I agree with everything you guys are saying. In fact, you know, there you go, Susan. I mean, take out gluten from your diet, dairy from your diet. Give it 6 weeks before reintroducing to see what the change and difference is. To get that food sensitivity test accomplished, it's a black and white list. What are you allergic to or sensitive to, and what are you not? And take those out of your diet. Lastly,
she also should consider checking her vitamin D level.
Vitamin D,
unfortunately, that's been delisted by OHIP
as
lately.
As of December 1st, unfortunately. You have to pay for it. It's
very upsetting,
$75
but it's a very worthwhile $75.
Yeah, and you probably want to be taking in the many thousands. CFIP6, it's an inositol hexaphosphate, IP6, high dose of that, providing you don't get stomach sensitivity from that. It's a third thing I'd offer up. So take the foods away, lots of essential fats, maybe get that testing done, and IP6. It is time for our final break already. Up next, more tips for a healthier you in 2011 plus. We'll be taking more of your calls, and Dr. Oz will share with you his top 3 health tips that I've solicited from him for 2011. Keep with us.
Reach us in the GTA by dialing 416-872-2724 or outside the area at 1-888-863-2724. Send an email to wildeonhealth@cp24.com or follow Bryce on Twitter by visiting cp24.com.
back talking about how to be a healthier you for 2011 with Dr. Matta and Dr. John Dempster. We're going to go right back to the phone lines. And first up is Mark. Mark's calling in from Toronto. Hi, Mark.
Hi, great show as always.
Thank you.
I'm calling in behalf of my mom. She's been complaining for quite a while now of extreme bloating, and she recently found out that she has H. pylori, and which we found out to be somewhat common. But she wants to get rid of it, and she wants to get rid of it naturally. Sure. Her doctor is suggesting, though, there's nothing natural that's strong enough that she can take to get rid of it.
Yeah, normally they recommend a triple antibiotic and an acid suppressor, and in fact that's wrong. There are natural things to get rid of it, and unfortunately certain of us succumb to it. It's actually quite inherent to most of us. It's just when it's an opportunistic situation takes advantage of you. Dr. Dempster, quickly, I mean, how can she resolve Mark's mother resolve this, or how would she go about testing and then resolving?
One of my favorite tests is called a comprehensive diagnostic stool analysis. This will allow you to figure out exactly if it's just H. pylori or if there are other organisms involved as well. It'll also tell you which nutrients or drugs will actually help eradicate it, or be sensitive or resistant to it.
Or to natural medicines for that matter,
That's
right?
Correct, yeah.
But can she start right away with high-dose probiotics and possibly even DGL, deglycerized licorice? There's some other things.
Great start. And also get your acid levels optimized. A lot of us think that we have to get our acid levels suppressed. You actually have to have them at a certain level.
Good stuff. On to Rose from Brampton. Hi, Rose.
Hi, good evening.
Good evening. Go ahead.
Actually, mine's more not so much a question, but looking for information.
Yeah, that's what we're about.
I've been in menopause for, 3 years.
Okay.
And I'm still experiencing a lot of unpleasant symptoms, and I've been looking for information on the web. I've been reading. There's a lot of talk about bioidentical hormones.
Sure.
And
okay, so possible, further investigation into the hormonal status of your body to, help with everything from health to the aging process is what you're looking for. Where to look for more?
Exactly.
Okay, Dr. Dempster.
One of the first things, Rose, is make sure you're getting your hormones tested properly, and this means that we want to be looking at the free levels via saliva. That's one of my favorite tests for hormones, not just looking at a total count in your blood, and we want to understand what's at the tissue level. Bioidenticals are a great way to go at it. There are some natural methods as well, and these would be discussed with your naturopathic doctor or your medical doctor.
Hope that helps, Rose. GDX.net. GDX.net is an incredible diagnostic laboratory found in North Carolina, of all places. Lots of information there. Dr. Matta, we still so much on the table. Let's get through some of this stuff, because I think it's so interesting, and then we'll get back to some more questions. So just walk us through what we're looking at here.
This here is Latisse, which is the first of its kind prescription treatment for eyelashes.
Yeah.
So it lengthens eyelashes by about 20%. It will double the thickness of the eyelash, and it increases the darkness by about 20%. So it takes about 4 to 8 weeks to kick in, sometimes up to 16 weeks for full effects, and then you can drop down to, every other day treatment.
That's got to be helpful and something interesting for people who are on chemotherapy, with cancer, losing their eyelashes, or possibly alopecia.
Yep. It is a wonderful treatment for patients that do have cancer and are under chemotherapy and have lost their lashes. As well, there are people that use it for their eyebrows, and it's even been described that people are using it on top of their head to improve a little bit of hair growth on their scalp.
Interesting. Okay, interesting. Question coming in from Christine by email, who's asked, I'm a recently turned 48-year-old lady, and I'm noticing that under my eyes there are dark circles. How can I either eliminate or lessen these? Is there a laser or something she could do?
Dark circles under the eyes are a very difficult thing to treat. They're generally genetic, and there's a big dietary role, which Dr. Dempster will get to. For us, one of the small things we have is vitamin K creams, which can help in some light-skinned individuals, but for the most part, it is a difficult area.
Dr. Dempster?
Optimize B12 and iron levels, and rule out any food sensitivities again.
Okay, great. And possibly B12?
And B12.
Okay,
that's right.
And put that into some really quick, because I got to get out. But Botox. I mean, it's been talked about as some dangerous stuff.
It's not just for wrinkles anymore.
It isn't, right? It isn't. Just quickly, because we have 20 seconds.
It originally started therapeutically, went cosmetic, and now it's back to therapeutic again. So we use it for sweating, we use it for migraines, we use it for neck pain,
TMJ.
We use it for TMJ, people that grind their teeth.
Guys, thank you so much. Time flew. It's been so much fun. Doctor in, doctor out.
Pleasure.
We'll see you guys back again soon. My final recommendations, well, my friend Dr. Oz and I are definitely on the same page about most things, as you know, including our top 3 health tips for 2011. He sent me a video to share with you, and let's take a look at that right now.
Hey, Bryce, Dr. Oz here. I'm here at the studio at 30 Rock. Taking care of your health is important, which is why I'm glad you asked me to share my message with your viewers. Here are my top 3 health tips for 2011. Year after year, we say we're going to lose weight, yet many of us still fail. Well, this year, set a realistic goal to lose just 10 pounds. Why? Because losing 10 pounds reduces the risk of heart attacks by more than 50%. It can reduce your blood pressure, decrease your odds of getting osteoarthritis, decrease your risk of certain cancers. It can even help you sleep. And one easy way to get started is by swapping out the snacking in front of the TV for exercises. Try doing some lunges or push-ups against the couch. It'll build calorie-crunching muscles and keep you from reaching for junky snacks. My second tip for the new year is to learn or relearn CPR. Nearly 45,000 cardiac arrests occur each year in Canada, and less than 5% of those who go into the cardiac arrest outside the hospital survive. But there's good news, though. New studies found that survival rates increased to nearly 12% when bystanders were able to do simple basic CPR. So this year, head down to your local Red Cross and enroll in a class. It could save a life. My third tip is one I talked about all year long on my show. Know your 5. The first step on the road to better health is to learn these 5 life-saving numbers. They are your blood pressure, your waist size, your weight, cholesterol, and your fasting blood sugar. You can get them tested at your annual physical or at a local clinic. By staying on top of your stats, you'll banish the threat of major chronic diseases and bump up your odds for longevity. So here's to a happy and healthy 2011, and don't forget to keep tuning in to the Dr. Oz Show weekdays at 5 p.m. on CTV.
Dr. Oz, thank you so much, and don't forget to watch Wild on Health Fridays at 7 p.m. We'll see you all soon. Best of luck and all the best of health in 2011.